Good afternoon, my friends. The doctor's in the house. Welcome back to another episode of To Your Health with Dr. G. Oh my gosh, I'm so excited to bring you guys back in studio live today on a great day. It's kind of cold outside on this Wednesday, but that's all right. We're still here bringing the thunder. Again, it's all about building trust and delivering truth. So welcome back to another episode of To Your Health with Dr. G. My name is Dr. Mark Gomez. I'm a board-certified internal medicine physician. I'm also a member of the American College of Lifestyle Medicine. And I am excited today. I have to give a quick shout out to my wife, Tiffany Gomez. Today is our 70th episode of To Your Health with Dr. G. I'm so excited. And I tell you what, those of you that have been out there supporting us during this whole time, I have immense gratitude. And I tell you what, we're going to do 70 more. We're just going to keep this going on. This health journey has to continue. This revolution, inspiring lives, inspiring better health, and having people live their life to the best of their ability with their family and loved ones. And today's show is not any different. We're going to bring you today a sports medicine update, something that I feel passionate about. You know, I see a lot of patients in my practice every day that are engaging in physical activity, a lot of people competing at a high level. I've had former professional athletes that are current members of my practice. And so it's so great to talk about something that we can all relate to, the competition of sport, that competitive aspect, us trying to really push the human body, to push our health to higher dimensions and more engagement, because again, what we put into our health is what we're going to get out of it. And again, as you have success with your health, you're going to have more opportunities for success in your life. So we're joining here live here at Intellectual Radio Studios. Again, my name is Dr. Mark Gomez. We are checking me out on my website, www.drmarkgomez.com. Today, Sports Medicine Update. I'm so excited. Again, 70 shows. I can't wait to keep it going on. So, you know, we all talk about sports. We love sports. I'm going to talk about my favorite sports. We're going to meet my panelists and everything too. But what I want to do today is I want you guys to share this message. You know, we all want to share, you know, all my guests that I've ever had on my show care about your health and your well-being. We want you to do well with everything that you're doing. Again, we talk about moving more, eating better, stressing less, getting sleep, things that are foundational to what we want to do to be well, to engage in our lives, to really be intentional, and to serve that higher purpose. Again, having higher purpose and perspective in your life. But your health, make no mistake, is a foundation for everything that we do. So I'm excited to welcome you guys back today. What I want to do, of course, those of you that are new to us, what I do each week is I interview my guests. I welcome experts, clinicians that are in the field day in and day out. But anybody who's passionate about health, I think there's a good platform to talk about this. And so I want people out there to really heed the words that they're saying. But again, today we can all relate to this concept of sports medicine updates. So we're going to talk about the latest and greatest that's out there. We're going to talk a little bit about some of the training techniques. We're going to talk about really 3 broad kind of topics. We'll get more specific. We'll talk about preparation. What does it take to compete? We'll talk about what you need to be doing when you're in performance at in-game scenarios, and then of course recovery. So we're going to frame our discussion around those kind of themes. So but before we meet our guests, I am going to read a quick disclaimer. Here we go. The content of To Your Health with Dr. G is for informational and entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and/or treatment. Further details can be found at www.toyourhealthwithdrg.com/disclaimer. So I was saying earlier, those of you that are new to us, we interview, we talk about a topic, spread the message. Those of you that have been joining us for these 70 episodes now, thank you again, and stay with us. This journey continues. So what I want to do today is I'm going to introduce my guests, and these 2 individuals are just awesome people. They've taken care of my patients, and if I ever get into a bind, personally, I know I'm going to go see myself. And so I want to make sure, again, we have the right people on, and then these 2 experts today, they really care about your health and your well-being. So don't forget that, you know, we want you all to do well with everything that you're doing. So before I introduce my guests, I just want to give you a quick background why I came with this idea of the show. I put it out on Facebook a few months ago that I was training for a 5K. I had my 5K done last month. I succeeded. I'm not going to tell you what place I got in men age 40 to 45, but I will tell you this. I did not finish first place, and nor did I finish last place. So there you go. It's all good. But again, I had this idea a few months ago as I was training for a 5K, and I said, you know what, let's talk about it. I can give you some of my personal insight of what I've done to help train for everything, and also recovery. So I cannot wait to talk about this with people that are in the field. So without further ado, I want to introduce my guest. My first guest. He and I go back together. We work together with Edward-Elmhurst. He's an expert in his craft. I want to introduce you to him. I want to read his credentials because his credentials run deep. All right. My first guest, my good friend, Dr. Henry Legaspi. Dr. Legaspi is a board-certified physical medicine and rehabilitation physician. He's with Elmhurst Neurosciences Institute. Check him out, www.eehealth.com. Dr. Legaspi, welcome to the show.
Thank you for having me.
Hey, I'm so excited. Please tell us a little bit about your background. Where did you do your medical school? Where did you do your training? And maybe a few opening remarks on what this theme today means to you.
Sure. So I did my medical school training at Midwestern University in Downers Grove. I did residency in physical medicine and rehabilitation at Loyola University Medical Center. The field of physical medicine and rehabilitation is basically keeping people as functional as possible, despite some sort of disability or impairment. So, when you take those principles and you take them to sports medicine, basically what you're doing is you're trying to optimize somebody's physical health and fitness so that the athletes stay on the field and stay safe.
Excellent. Well, thank you, Dr. Legaspi. It's been great. It's great to have you here today, and I cannot wait to get more detailed into some discussion so we can give some really good tips out there for people listening to us today. My next guest, she and I go way back, many years. Good friend of mine, has taken care of a ton of my patients. She's been on To Your Health with Dr. G before, and I'm so glad to welcome her back. My really good friend. Let me read the credentials. Dr. Tiffany Crutcher. Dr. Tiffany Crutcher is a clinic director. She's with ATI Physical Therapy. Check her out at www.atipt.com. Dr. Tiffany Crutcher, welcome back to the show.
Thank you for having me.
Hey, this is, we were going to do this. We were going to do this regardless. Last time we connected, I was like, okay, we're going to do this again. So I'm so glad to welcome you back and really talk about a topic that you were so passionate about as you take care of so many patients, from just the weekend warriors to the professional athletes to somebody who just wants to get started with physical activity. You see it all. So I'm excited to welcome you back. Tell us a little bit about your training. Where did you do your PT school, some of your advanced training, and a few words today about what this theme means to you.
Okay, sounds good. I did my PT training. I got my doctorate in physical therapy at Northwestern. What kind of brought me to this field, though, was I was a college athlete, seeing a lot of my teammates get injured and things of that nature and watching their recovery process. I was really intrigued by watching them, seeing how they could go from an injury and actually they were better athletes when they were done with this process, so going through rehab and things like that. So that's really what brought me to the field. Excellent.
Well, thank you, Tiffany, for coming on today. I want to really continue to pick your brain. Again, it's all about having people that are in the trenches. And I'm in the trenches myself, but I recognize where my limitations are as a primary care physician, but I can talk about a lot of different things. But when you have people that are in the field, working with people to get them to perform better, to function better, it's great to pick their brain for some insights. At the end of the day, of course, we want you to see these individuals, so if something comes up, and if you're local, in Illinois, yes, we want you to see Dr. Legaspi, we want you to see Dr. Crutcher on things that they're trained to do and passionate about doing. And at the end of the day, we all want people to move forward and want them to move backwards with their health. So the chief complaint, is when somebody comes into your office and they tell you what they're there for, aka the question of the hour. We do this every week on To Your Health with Dr. G. Here it is. From professional athletes to weekend warriors, people who love the spirit of competition want to perform at their best. What are the best strategies to improve sports performance? And again, we're framing this today from preparation, performance as far as in-game routines, and then of course recovery. And those are very broad topics, and we can get more specific as well. But again, we want to frame that conversation around that. So we want you at home to have some good ideas to go. And again, if something comes up, further questions come up, please talk to your physician, talk to your clinician, reach out to experts and everything that you have. But again, we want to make sure this conversation keeps going forward. We want to move together without a doubt. So let me ask this question to Dr. Legaspi first and foremost. Why don't we do this? Why don't we talk about, just give us an idea, a lot of people don't know what a physiatrist is, physical medicine rehabilitation. Can you tell us a little bit more about that field, just to kind of establish the baseline of the foundation of what you do for so many patients?
Sure, yeah. So, a lot of people are confused as to what physical medicine and rehabilitation is and what we have to offer. The reason why I got into this field is because, you had patients who had some sort of chronic illness, maybe they were in the hospital, and, they were just kind of languishing for sometimes days, sometimes weeks. And then, from medically, they're all tuned up, so to speak. But then they're so deconditioned that they can't do the things that they need to do to take care of themselves or to be a productive member of society. And that's the whole point of physical medicine and rehabilitation. Again, you kind of extrapolate that to sports medicine to keep athletes on the field and keep them healthy.
Absolutely. And then Tiffany, why don't you tell us a little bit about, from your role, and again, what you're doing, again, just to set the foundation. A lot of people have heard the term of physical therapy, but people may not necessarily know what it is and how it fits. But can you give us a quick overview of what, just kind of broad sense of what physical therapy is and what your goals are?
Absolutely. So physical therapy is basically like the study of human movement and rehab. The idea is that if someone has any sort of illness, injury, surgery, things of that nature, they are to come see us, and we are able to help them physically get back to whether it's something as simple as being able to get out of a chair, or an athlete trying to return to sport. We try to give our patients the tools to get their body back in optimal health and optimal physical conditioning.
Excellent. For me as a primary care doc, I want people, and I talked about this before on the show, I want people to move to the best of their ability. And when you're talking about physical activity, whether you're a weekend warrior or a professional athlete or a former professional athlete, I have many of those in my practice at all levels of sport, we have a higher goal. Obviously the spirit of competition, you want to win, and we're coach to that, but sport teaches you a lot about life, and it teaches you about teamwork, teaches you about discipline, consistency, and there's so many things that have to go right to compete at a high level. And I think about for you, Tiffany, you compete at a high level in college basketball. You can't just take shortcuts to get to that level. A lot of times in life, we see a lot of patients in our practice, our clients, that want the fast answers to some of their medical ailments, but it doesn't necessarily work out like that. Mm-hmm. Certainly if somebody's got certain conditions where it's like, okay, you got a broken bone and that might require a surgical fix, that's something, that's it. But there's a whole rehabilitative course after that, and so we don't want to shortcut anything. Mm-hmm. So let me ask a question to Dr. Legaspi. Dr. Legaspi, when you think about what people need to do, we're talking in this context of physical activity. How do we get? Well, let me just say it like this: how do we get more people to just make physical activity personal? You don't have to have this. You don't have to do what everybody else do. But how do you make it personal?
Well, I think that, for starters, when we talk to people, we need to meet them where they're at. Okay. But the other thing is, we've got this thing. If people do this thing, they live longer. Their blood pressure is controlled. They don't have strokes. They have diabetes. It's controlled, and it's called exercise. Yeah. So if you can harness that, in a way that a patient likes to exercise, then you will literally make them live longer and have a better quality of life.
I like that word, live longer, longevity. I love that, and it's absolutely true that the data shows when you're doing things that you're doing, and have success with being more physically active, yes, your chance of diabetes, if you don't have diabetes, your chance of getting it goes down. If you have diabetes, your numbers get better. Chance for heart disease goes down. If you have high blood pressure, your blood pressure comes down. So there's so many health benefits, but also just even just like some of the other benefits, vitality, energy, and not only will you be living longer, you'll be stronger, you will feel more energy, and then you'll even have an aesthetic look. Why not talk about that a little bit? There's a little bit of aesthetics when it comes to physical fitness and everything, but also engaging in more quality of life. And I would say, like, people that are doing a lot of exercise, they're able to, they when they were disciplined, and I'm going to pick your brain in a second on it, because I got this question for you, Tiffany, but not only disciplined, because everything else has to fall in line. Mm-hmm. So your nutrition's got to fall in line. So other sleep's got to fall in line. So other aspects of your life fall in line to be able to perform. So let me ask you this question, Tiffany. When you were competing and when you were a college basketball player, what was kind of your mindset? Is there something like you would have known now, back then, that you know now, that you could have used back then during your competition days?
Absolutely. Definitely better nutrition.
Okay.
And actually sleep. Just being in college and stuff like that, like, you're not worried about sleep, you're not worried about nutrition, you're going to fast food, things like that. I probably would have competed better if I slept more and ate a whole lot better. And I think a lot of people, even outside of it, even now trying to exercise, we never have time to sleep. Usually you're rushing to try to get something to eat. So definitely if I had known that more now, I was training, I had strength and conditioning coaches, I'm practicing multiple times a day, but I probably would have been a better athlete if I had controlled those two things a whole lot better. So, yeah.
We were talking before we got on air, where I was talking with Henry and Tiffany about obligations, and certainly since you're thinking of that mindset, if you're a 20-some-year-old kid and you're competing at a college basketball or high level, whatever kind of sport you're in, you're still balancing that with school and all sort of kind of stuff. So there's a lot of obligations, and something that's to get cut. We all get the same 24 hours. It's a matter of what do we do during those 24 hours. A lot of us may have our 9-to-5 job, although it seems like there's no such thing as a 9-to-5 to stay in age. You're there from like 8 to 8. And then some of us that are family members, that are parents, we have to take care of our kids, and those that may have older parents living with them at home. Mm-hmm. So our obligations, our amount of obligations in that given 24-hour cycle, it seems like at this point in life is full of obligations more than any other point in life. And so the amount of time that we have to focus on ourselves, some of that discretionary stuff outside of work and family and that care and caregiving and child rearing and whatever, the amount of that discretionary time to focus on something like this tends to seem like it's going down. What's your take on that, Dr. Legaspi? Is like maybe like, because you think, I'm thinking about when you're working with patients and you're saying, okay, I need you to do this and this and this, and they might come back and say, well, I can't because I have this and this and this going on. How do you find some common ground or a middle ground at all, especially when you know that it's going to take some more of an effort? I'm not going to say a Herculean effort, but it's going to take some effort to get them to improve.
Right. You have to find some way to leverage them. For people who are, primary caregivers, or they have a lot of people depending on them, usually I actually try to leverage it by stressing on them the importance of taking care of themselves first. Because if they don't take care of themselves, how are they going to take care of other people? How are they going to be, a good parent, good husband, good wife, good spouse, good, whatever occupation they have. So usually I use that to try to get them to be healthier.
Excellent. So, Tiffany, let me ask you this question. So, we're talking about, it was interesting, I'm come back to what you were saying a few moments ago about, you wish you would have did this back then that you know now. We're talking about preparation. And that's one of the things I want to start out with as we're talking about today's conversation. Preparation. A lot of people, when you think of the word preparation, they think of time consuming. How do we kind of get through that kind of barrier? Again, if you know someone needs to perform, and we're talking about the benefits of activity, regardless of somebody at an elite level or at a beginner's level, there's preparation involved. How do you just start having that conversation with somebody?
I know, just how you were saying before, though, just somebody to try to get them moving at all. You don't have to have an hour of time to get going. Like, you can have a few minutes here and there. You can do a 10-minute something here, a 15-minute something. It's the cumulative average throughout the day. So the thing is, you pick and choose times when you can actually be a little bit more active, whether it's taking the stairs, whether it's when you're at your kids' practice, you walking the gym or the field or things like that. The first thing, though, I would go if I'm trying to get prepared to do an activity is I want to try to have some good nutrition, and I want to make sure I get enough sleep so I have the energy to be able to actually even do that to get started. So
excellent. Dr. Legaspi, what's your kind of take on preparation a little bit more? We're talking a little bit about lifestyle, nutrition, sleep. What other kind of recommendations do you typically have for your patients as you're gonna help guide them through a journey to perform better?
Well, I think particularly the people who are trying to start exercising, it's important to meet them where they're at. And, part of it too is no shame, no blame. Let's say you were very active in high school and, you may have fallen off the wayside a little bit. And, patients think to themselves, how am I ever going to get back there? No, just where you're at is where you're at. You know where you're trying to go, and then you break it down into incremental goals so that you can maintain your motivation.
As one of the things I always tell my patients, and I think really as a role of a physician, you are certainly a motivator. You are a coach. Whether when we're talking about whether it's somebody's being framed in the discussion around high blood pressure or diabetes or whatever, I always ask my patients three things. I go, what, the why, and the how. So again, what are you trying to do? And they can answer that. But why? I like to get to the why. Why are you trying to do it? What's your motivation? What's that purpose? And then lastly, once we can get that, then how are we going to do it? How are we going to develop that plan? And I think that works really well, whether it comes to like managing a medical condition, or certainly me engaging somebody into wanting to do activity or performance or whatever. I always have to ask those three questions. And I want people to be very introspective, so then they can actually engage in that behavior. And again, it doesn't matter if somebody's a weekend warrior, a pro athlete. Again, I have a number of former athletes in my practice, or someone who's just starting from zero that wants to just lose weight and just move more. But at the end of the day, I always say you got to make it personal. What you're doing, what somebody else is doing, may be that person's plan, but it's not part of your plan. And so the preparation is huge. So I want to expand on a couple of things. So you both mentioned sleep. I know you said, but nutrition. What other things are you guys talking about to patients as far as preparation? Do you see anything else that you're mentioning? General kind of lifestyle tips.
Just how you were saying, like, are you saying like the why? Why I'm actually doing this? I also think it's good to have a pretty good knowledge base of, okay, yeah, maybe you were a superstar athlete in high school or college. You're not going to go out and kill it your first time getting out to the gym or to the field or whatever, because then you're going to hurt yourself, and then that's going to kill your plan. So I think you need to prepare and have a good plan of what you're actually trying to do and what you plan to do, how to manage the pain, or how to gradually get back into something. So I think just knowing what you're going to do, talking to your physician about what you're actually healthy and able to do. It's not just somebody always that's going from nothing to something, or it could have been, like you said, a former athlete at a high level and they're just trying to get back. So I think just kind of having a plan of what you're going to do and what your overall goal is. So
Let's talk about a little bit screening. And is there any kind of general thumb? Some people are out there or maybe hearing our message today and say, you know what, I want to do something. I'm feeling motivated to do something. Where do I start, or should I get screened or anything? What's your take on that, Dr. Legaspi, on how should somebody start? Should they go through it? Should they start by seeing their doc to make sure they're first of all healthy enough to engage in something? Should they get some sort of formal screening, whether it's a movement screening, a functional movement screening, or injury screening? What's your takes on that kind of stuff?
For patients who have identified health conditions, it probably does make sense that they talk to their doctor. Let's say they have diabetes now. Well, the more you do some sort of aerobic exercise, you may actually drop your sugar. So it's important to coordinate with your doctor if you have health issues that may arise when you're exercising.
Excellent. Tiffany, what's your take on that one? Should people be getting some sort of a screening evaluation before they engage? Or would you say maybe it depends on the level of engagement that they're trying to get into as far as the level of activity?
I do think it's a good rule of thumb to check in with your doctor and things like that. I would say it does depend on the level of activity that they're doing, but also at the same time, if you have any sort of ailment, any sort of knee pain, back pain, if you have any sort of thing that are bothering you, you can go by almost any physical therapy place and they will do a complimentary screening on you just to make sure that you don't have an injury. You may just have some soreness. So I do think it's a good rule of thumb just to kind of follow up with a physical therapist. Every place does complimentary screening, so if there's any sort of injury, we can kind of tease that out, and then you can go ahead and start on your journey.
Well, that's certainly the smart way to do it, and that's great to know that those kind of resources are out there for people. And so I challenge you, if you were trying to do something, yes, definitely check out your local physical therapy facility and inquire about free screening, as Tiffany just said. It's interesting, that reminds me, you mentioned about the screening, reminds me like when you do those home videos, and like it'll say warning at the beginning, and you're like just trying to fast forward, like when am I get to the main screen, and then it says, please consult your doctor if you have neck pain, back pain, shoulder pain, whatever. Do not do this thing. That's obviously a big disclaimer at the end of the day, but there's actually some truth behind that, because the last thing you want to do is have somebody start out that wants to be intentional and they get injured right away, and then now you're back to the drawing board, and then they may not want to do any other kind of exercise thereafter, and that can be really tough to get somebody out of that. So I want to go back to something that I think is important, that when I'm telling my journey, and when I came up with the idea of the show, is that I wanted to do a 5K. And so I told my wife, I go, hey, I'm going to do a 5K. And she's been amazingly supportive, and my wife even got out there. There's some pictures on our Facebook page. Just check it out on my website, www.drmarcombs.com, or check it out on Facebook. But there's my wife engaged in the 5K as well too. And I would go out and say, all right, I gotta come with a plan. So my preparation was sleep more, because I know I gotta eat more sleep. And I did a show a few weeks ago about sleep. I was like, I got to sleep more, because there's no doubt that the lack of sleep, sleep and sports performance are so intertwined. They're so connected, because the lack of sleep can adversely affect your ability to perform, whether it's from your immune system, stress levels. You need to sleep to reduce some of those cortisol levels. You need to now promote proteins that help out, that play a role in fighting infection and inflammation, and helping the body deal with stress. We call those cytokines. And so, we want to do that. You want to look at your musculoskeletal system. We know that when you sleep better, your muscles feel better. Actually, sleep helps stimulate muscle growth. We want you to do that kind of stuff. And so, and there's a whole other things too. We talk about bone health. You can talk about, the reality is sleep affects every organ system in the body. And so my personal journey was sleep, try to get more sleep. And then number two, I've been on this journey to change to more of a plant-based approach. And my wife and I have been really much in the game of doing more plant-based approaches. Great documentary out there, The Game Changers. Check it out on Netflix. It is a wonderful documentary where they have the best athletes in the world that are plant-based, really talk about the science, but also the performance activity. There's a lot of myths out there that people say, oh my gosh, I just got to eat a ton of chicken and beef and all that kind of stuff to perform, and that's actually not true. And I encourage people to watch the show themselves, and of course come to your own conclusion. But there's no doubt that a plant-based approach, predominantly plant-based approach, is very beneficial. But it's beneficial from not only from performance, but it's also beneficial from a health standpoint. We've talked about it, something called the blue zones. People on Earth that live the longest, they are 95% plant-based. There's a fact. Check it out, blue zones. Anyways, so Dr. Legaspi, let me ask you this question. Do you believe in like warm-up stretching? Is there like, and people ask me this all the time, well, how long should I warm up for? How long should I stretch for? How do I do this? When you get some of those common questions, what do you say to that?
Depends on your level of activity, really. Warm up in particular for runners is very important, particularly dynamic stretching, more than just passive stretching in order to, get the blood flowing, make sure you don't injure commonly injured areas like hamstrings.
Is there a difference? Can you explain a little bit what dynamic is versus more passive stretching?
Yeah, passive stretching, like kind of, Tiffany can help me with this.
Yep.
Yeah,
But passive stretching, that would be like forward bending, touching your toes, that sort of
the
thing.
old school kind of stuff that we used to do back in the day as kids.
Yeah, right. Versus, toe touches and that sort of thing. Much more dynamic.
What's your takes on that?
That's a topic that comes up all of the time because
Yeah.
everybody thinks you're supposed to, do the whole touch your toes. You're supposed to, stretch your quads, bring your foot to your butt, all that stuff. But the thing is, static stretching, what it does is it's trying to relax you and lengthen your muscles. But if you're getting ready to do an activity, you actually want to turn the muscles on. We don't want to inhibit your muscles. So I preach this all the time. Like, you need to do a dynamic warm-up. You need to get the blood flowing. You need to get circulation going, things like that. You need to be warm because if you go cold you're going to hurt yourself. So, and I do say static stretching is good, but it's more towards the end of a workout versus the beginning of the workout. When you are trying to relax and you're trying to slow everything down, inhibit everything, that's when you do static stretching, not during at the beginning. So,
Excellent.
yeah.
So I agree with that. That's kind of my take on things. So I want people to not just have a cold start on something, just get the body moving. And sometimes I gotta go old school. Yes, your dynamic stretching, but even things like just jumping jacks. Just some high leg raises. Maybe a couple butt kicks if you can do that in place. Something just to keep the body moving. Also, especially if you're trying to wake up in the morning, I don't want people to just like wake up at 5 a.m. just roll out of bed and just start going outside. Get the body prepped. You just came out of sleep. You're probably still barely waking up. Like, get something going on there. So let's talk a little bit about preparation. We already did preparation, but let's look a little more like in-game performance. So say you're in the middle of an activity. I'm thinking of me. I did all this training to get ready for my 5K and everything, and I'm in the middle of my 5K, and I'm like, Lord help me, I need to stop right now. I'm just joking, I didn't say that. But Lord, make this race over. Again, I said I did not get first place and I did not get last place. I was somewhere in the middle. I'm at a bell curve, you know what I'm saying? It's all good. Bell curves are great. You want to be just right in the middle. I'm just kind of an average person. So it's all good. So let me ask you this. So you're in the middle of performance, whatever activity it is. How do people, let me ask this question to Dr. Legaspi. Fatigue sets in for a lot of people right away. How do people combat fatigue when they're doing an exercise or some kind of performance? While you're still doing the performance, are there any kind of things you tell your patients or your clients?
That's tough. I mean, because really, when fatigue, once you're already in it, certainly you can improve your activity level in the future. Some of it by preparing well in advance, hydrating right and eating correctly. Other than slowing down some, once you're in it, I don't know that there's much you can do to get your energy levels back up.
What's your take on that one, Tiffany? I haven't played at a high level in college, but also still as you work with clients now, whether in the game, what are you telling them?
I always say that when you first feel fatigued, that's just your mind telling you that you're fatigued. Like, you just got to get your second wind. I honestly tell people, like, just push through. I mean, if you're not having any pain or things like that, like, it's just your body telling you that you're already tired. But really, if you keep pushing and you've prepared and you've trained for it, you're really okay. Yeah. So
that's like me. I'm in my 5K, and I think I got the first 100 meters, and I said, okay, all right, is my body ready to cash out right now? I'm not ready to cash out just quite yet.
Yeah.
But you just kind of block that out. And again, I come from a mindset where I'm more of like kind of the weekend warrior kind of thing, where I have a little more time, flexibility in my schedule to do more things on the weekend. But yeah, when I go the full week and I haven't done much, it is, I can notice that right away. But that's why I think for a lot of people, if you just start sleeping better, sleeping more, maybe eating better, staying hydrated, that might be the extra boost that you need to get you past those hurdles. So let me ask you this question. I'll come back at Tiffany with this one. what's your take on electrolyte drinks? Are you advising that kind of stuff to clients? When you were playing, did the coaches like say, all right, you're sitting on the bench, after you got out of the game, came out, timeout, they say, all right, drink up, hydrate, electrolyte tabs, all that kind of stuff?
I don't know about all the tabs and things, but definitely hydration through water. I always tell all of my athletes, non-athletes, things like that, if you have an injury, whatever, I always say hydration is key. So my rule of thumb is whatever your body weight is, half of that in ounces of water. Whether you're recovering from an injury, whether you are participating in an activity, you need to increase your fluid intake. As far as like the electrolyte tabs and things like that, I think they're really only, and from my experience, they're only really appropriate for long distance runs. If you're marathons, the 10Ks, I haven't used them personally. I just know that I think people tend to overuse supplements and such like that. If your nutrition is good and your hydration is good, you don't really need all the extra tablets unless you are really putting your body through it, like all these ultra marathons, things like that. Then I can see you using them.
What's your take on that, Dr. Legaspi?
Well, I agree. If you're doing activity for over an hour and it's fairly intense, vigorous activity, then yeah, I think it might make sense to do some sort of electrolyte replacement. But for the vast majority of people, you don't really need gels or tabs or anything like that. And you're never going to go wrong with water. Sometimes it makes more sense to drink a sports drink rather than to drink water. Like say if it's a hot summer day and you've lost lots of fluids and you probably lost a lot of electrolytes with it, then yeah, maybe it makes sense to have a sports drink. But really, you're never going to go wrong with water.
I agree. I tell my patients, and I even do it myself. And despite a lot of the big companies putting ideas in our mind about take this electrolyte tablet because this particular superstar is on our payroll, kind of thing, and that's the reality. So we get these images put in our mind. But I just say, water. There's nothing wrong with water. If you're doing a 5-minute or 8-minute Tabata workout or 10-minute exercise, you can still just do water. You don't have to necessarily, some of those things, no doubt, you're sweating. Sometimes people can sweat right away. There's no doubt. But you're fine with water. And just keeping that going. Hydration is a great thing, but I don't think you have to necessarily do stuff. Now, when I did my 5K, I'm only out there for 30 minutes, so I don't necessarily need to have a lot of electrolyte replacements. I did drink water during the course, but I'm not reaching for my energy gel or anything like that for something like that. If you're doing more extended performance, then maybe that's a game thing. But again, this is where I want people to, you got to find out where you're at. We're talking from our experiences, but you got to go from your experiences and work with your medical team and your healthcare team to kind of find out what's going to be the best approach for you. So again, I want to make sure that, again, you got to make it personal for you. So let me ask this question. I want to ask one more question related to why you're in the game, performance. Okay, injuries happen. We know that's a fact. Let me ask this question to Dr. Legaspi, and I'll get Tiffany's take on this one. People sometimes perform, they get injured, they feel the pressure to continue to perform, potentially provoking even more injury. But how do you kind of get to that point where you say, and I don't want to have the mentality where it's like, oh, well, everybody's playing hurt, so you just play hurt. But how do you know, for people that want to be smart about it, how do you know when to say, I can push through a little bit of discomfort, or I need to just say stop?
Well, if you're having a lot of pain when you're doing some sort of essential task to that specific sport, then yeah, you should probably stop. And obviously for some things like concussion, if you're getting evaluated and you're dizzy, just trying to focus on something, that person clearly has to stop. But like I said, if you're able to sort of push through and you're not causing too much discomfort, then maybe it is okay to continue. But some of this too needs to be in conjunction with the athletic trainer, with the physical therapist, with the doctor on the sideline to make sure that you're not injuring yourself by going back.
Tiffany, what's your take on that one? You've seen like literally thousands of injuries that probably could have been prevented.
Right.
But what's your kind of take on this one? Somebody's in the game, even think about back to your college basketball days, you get injured, you might have some pressure to push through, to keep playing, but how do you be smart about it?
I kind of think that's when the athletic trainer can kind of take that pressure off of you. If you do get injured in a game, the athletic trainers are there. We're trained to see, what happened immediately. We have special tests and things like that to kind of rule out any major injury and things like that, because athletes want to get back in there. Coaches want the athletes to participate. So I think it's the role as an athletic trainer or the physical therapist to give it a no-go or yeah, you can go ahead. So we have a bunch of special tests to kind of rule things out, to kind of not make the decision for you, but almost push you in the right direction. I mean, yeah, we might be a little bit sore and things like that, but there are some clear ways we can discover whether it's a injury that you don't need to continue participating in.
Excellent. I like how you said where there are safeguards or systems in place because, as I said at the beginning, our chief complaint or clinical question, part of that is a lot of us like to engage in the spirit of sport, the spirit of competition, and sometimes you have to be safe from yourself. One of my old guests that came on the show, a guy named Dr. Frank Vaught, used to say, you got to check your ego at the door. And so, but some of us want to drive to compete, to do something, contribute, whatever, but at the risk of, is it worth the risk of potentially exacerbating or worsening the injury? And that's up to, that's a decision that nobody should take lightly. It should be a serious decision, but looking out for the best interest, you got to look more long-term versus short-term, without a doubt. So I want to talk about this. I want to spend some time on recovery because that's something I get asked a lot about. And I get asked a lot about these questions when I'm trying to deal with like diabetes and high blood pressure. But I'm here for all my patients that are out there. And like I'm here to answer your questions. And even though we might be talking about particular disease manifestation, I want to talk about what's going to help you perform better. Because again, as I said in the beginning, as you do better with your health and all aspects of health, it's a very broad term, but you're able to do more and contribute more in life. And so I have no problem taking that extra time to talk with somebody about this kind of stuff. So recovery, let's talk about it. I get asked this question quite a bit. Maybe I'll ask this question to Dr. Legaspi and have Tiffany talk about it too. People always talk about recovery drinks. I feel like that's one of the hot things. Like, Dr. G, when should I take my recovery drink? All that kind of stuff. Do we know anything? Is there any data that says to do it? Do we know about that kind of stuff that's published?
Not that I'm aware. I mean, the thing is, if you have a healthy diet, you can get most of what you need to fuel your recovery from choosing the right foods. It doesn't necessarily have to come from some sort of supplements, and it doesn't have to come from some sort of drink. And really, if you're getting the right amount of protein and carbohydrates within an hour of the activity, then you will be fueling your body for recovery.
Excellent. What's your take on that, Tiffany?
I totally agree with you. I'm sure there's some research out there, but I don't know if it's been significant enough for it to be the widespread rule.
Yeah.
So I do think like if you're eating appropriately, then you're gonna recover.
Yeah, I always tell people this. Especially if you're after a grueling workout or a long workout. Number one, get your hydration back in. Get your fluid consumption. Doesn't have to necessarily be a sports drink or anything. Like a lot of times you can just get by with water and have a sensible meal. That's going to replace carbohydrates. It's going to give you some protein loading to help those muscles that are they just broke down at a microscopic, or sometimes if it's an injury at a macroscopic level. But we want to get you the right nutrients, and then let the body rest. I think that's the thing that we don't do a lot. Is we might go from working out and then we're engaged in our day or whatever things that we got to do, and you're still moving around like that. But I feel like we don't rest enough. I'm not. I just feel like we don't do that. That's just my opinion on things.
Right.
So I think we got to do a little bit more. But let me ask you this: say somebody rests, and I'll ask this question to Tiffany. Say somebody's taking that rest and say, "Okay, Dr. G just said, okay, I need to rest a little bit more." When can that person engage again in that activity? I guess my question is more so like, can somebody do the same activity every single day?
Okay. So two things kind of that I always say after a workout. That's when you should be doing your static stretching. And that's when you should get into a really good foam roll routine. Just to kind of work out any sort of restrictions that happened along your workout and things like that. It also will help your muscles recover to kind of roll everything out. As far as, when can you engage in activity, I think it's a really good idea to not always do the exact same activity. You're going to have a degree of soreness in your body if you're working out hard enough to actually make a change. So that's why it's good not just to do aerobic training, not just do resistance training. You need to do a variety of things. So then I do think that you can exercise every day. You just need to do something different every day, which is actually going to make you an overall better athlete if you have different strategies and different methods to your working out.
Excellent. Dr. Legaspi, your take on that?
Yeah, I absolutely agree with that. There is a huge drive. This is sort of going a little bit off topic, but there's a huge drive for sports specialization, especially in youth.
Yeah.
Okay.
And I feel like I have to bring this up.
Yeah. No,
kids should be athletes first and specialists second.
Mm-hmm.
If any, this drive for kids to be a sort of specialist, like a pitching, let's say, kids are throwing out their shoulders and they're burning out because they're doing too much of any one thing. When you look at the NFL Combine, a lot of the people who go in the first draft, they were multi-sport athletes.
Yep. Mm-hmm.
And so, to prevent burnout and for kids to grow up, being elite athletes, they actually need to be athletes first and then specialists second.
That's
I totally agree, because that's what I always am like. I always see a lot of kids that are like 10 years old, all they do is throw, all they do is pitch. But you're a better athlete if you played multiple sports. You're strong and stable in different movement patterns. That's the biggest thing. You look at all these Division I and professional athletes, and the first thing they tell you is that they were a multi-sport athlete. But they've trained their body to move in any kind of position in any direction. So they're just better athletes in general. So.
I would say to argue. I'm not arguing. I mean, I believe you, but somebody might come back and say, well, if I don't do if I'm not doing this sport all the time, then the coach is not even going to take a look at me, or that's the parents saying that. That's not the kids saying that.
Right.
Let's be honest. That's the parents saying that. How do you respond to that kind of stuff? But I agree with you that it's got to be multiple different things. But say somebody were to come back and say, well, the coach is not going to take a look at me if I don't do this day in and day out. How do you respond to that kind of stuff?
That's a hard question, because there is a very big drive for kids to be sports specific, but the research just doesn't support that.
Gotcha.
Dr. Jayanthi, when he was over at Loyola University, did a lot of research on kids and burning out and sports specialization, and the rate of injury really does go up when you specialize too much too fast.
Well, I tell you what, I got the statistic for you. Here we go. 30 million teenagers and children. I was prepared. I'm like a Boy Scout. I was a Boy Scout. I only made it to Cub Scouts. There it is. But 30 million teenagers. This is from the Centers for Disease Control. 30 million teenagers and children participate in sports. This is in the country. High school athletes account for 2 million injuries per year. 500,000 doctor visits per year and 30,000 hospitalizations per year. More than 3.5 million kids under the age of 14 receive medical treatment for sports injuries each year. And that's just kind of a scary number. And a lot of that can be prevented. So we're going to talk about that kind of stuff. I actually did do a little bit of that stuff. You can find that archive. We talked a little bit about it a year ago, Tiffany, when you were on my show. But we talked about this. I even did a show called Fall Sports Prevention last fall. You can check it out on my website, www.drmarkowitz.com. So let's do this, guys. Let's get into some myths versus facts, something that I love doing every week on To Your Health with Dr. G. And for myths versus facts, what I do is I say a statement, and then I have my panelists say myth or fact. We'll kind of do a boom, 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 boom. You'll say myth or fact, gives a few statements why. There are right answers. And there are wrong answers. No, I'm just joking. No. This is your opinion on getting everything. But no, we try to bring the evidence with you. So, again, we want people to have the right tools, the right information, so they can make the right decisions on what they're doing regarding their health and their well-being. So here we go. Myths versus facts. This is the sports medicine update. Dr. Legaspi, you get the first one, my friend. Here we go. I like this one. Exercise negatively impacts pregnancy.
False.
Please explain.
Very much so. I mean, take one example, gestational diabetes. When you exercise, you increase insulin sensitivity in the body. So for those women who are pregnant, they will actually have decreased risk, or they will mitigate any problems with the gestational diabetes. But overall, they will be very healthier from a cardiovascular standpoint, and it's good to exercise during pregnancy.
Absolutely, thank you. That was definitely a myth. Here we go. Tiffany, here we go. Here's a statement, myth or fact. For recreational runners, running increases the risk of developing knee arthritis, osteoarthritis.
I looked at that one. That's tough for me. So I would think that it is a fact, just because I feel like the more you're doing, the risk is there. You can still run, but there's different surfaces you can run on. If you're running on a harder surface, you're going to increase your risk of some knee OA. But if you're running in the pool, or you're running on the treadmill, or things like that, the risk is going to not be as high as running outside on the concrete.
When I came with this statement, and it's interesting, I kind of put myself in the gray zone on this one too. When I came with this statement to kind of ask you guys about that, I try to think about the totality of the person. What do they do outside of just recreational running on the weekend or something like that? Are they a laborer? Are they work construction for 25 years and get some stuff, and so certainly I'd say if somebody's having knee pain and you're doing things and it's making the knee pain worse, that needs to get looked up. That needs to get worked up by your clinician, by your therapist, by your specialist, because we want people to hopefully not progress to the point where they're needing to take medications or get injections for their knee osteoarthritis from whatever they do. But I always like to take a look at the totality. So I always say, I ask that question, I say, what else does that person do in their life? Anyways, that's me. Here we go, Dr. Legaspi, here we go. Hiring a trainer is enough to hit your performance goals.
Myth.
Please explain.
Yeah, I mean, hiring a trainer will get you somewhere, that's for sure. But if you're not fueling your body for both performance and recovery, then you're really not optimizing where you could be. And so basically what I'm talking about is proper hydration and proper nutrition.
I agree. Thank you very much. I agree. That's definitely, there's so much more involved. The trainer can help. But as you said, there's so much more involved to hitting your performance goals. And I talked a little bit earlier about the importance of sleep. Got to do it. Here we go. Tiffany, here we go. Stretching before exercise will prevent injury. Myth or fact? What's your take on that?
It depends on the type of stretching.
Okay, fair enough. Yeah, please.
we talked about dynamic
please.
stretching versus static stretching. Static stretching, I think you will probably get an injury, or more likely to. Dynamic, I think it's an awesome way to get your body prepped to avoid injury.
And there's no doubt. Thank you very much. Here we go. Dr. Legaspi, it's okay to play through pain.
Myth. I would say myth. I mean, it obviously it depends on the injury, but if you keep going through something, you very well make an injury worse.
Yeah, I agree wholeheartedly. Definitely. Again, I cannot stress the importance of that. If there's pain going on, you've got to talk about that. You should be feeling that. You shouldn't be feeling that as part of your regular exercise. There's got to be something else going on, without a doubt. All right, here we go, Tiffany. I like this. Keep going. Eating just before bedtime makes an athlete fat.
I think that's a myth.
Please explain.
I really think that it's really calories in, calories out. Like if you're, the whole thing with intermittent fasting and such as that nature, like if you just are taking in fuel, it just depends on what you're giving out also at the same time. So it doesn't matter, I don't think, as much the time of day. I know that's the big thing is don't eat after 7 p.m. But if you haven't eaten all day, you need something to refill your body, rehydrate your body, things like that. I don't think that's going to make you fat because you ate after 7.
I agree, and I also tell some of my patients that are very performance minded. I always say, hey, I'm okay with you having a little bit of a protein load a little before you go to bed, especially as you're going to sleep. You're making growth hormone, your restorative hormones that are made out there, reducing your cortisol levels, and also knowing that sleep does help muscle growth. So I'm okay if you just work your body out and you want to have a little protein, get some amino acids in you to help refuel, and that's fine. And those people are definitely not fat. Mm-hmm. All right, so here we go. Dr. Legaspi, I like this. Here we go. Resistance exercise is a far more potent way to increase muscle size and strength than any protein supplement.
True.
All right, actually, you say fact. Please
Yes.
explain.
Protein supplements will only take you so far. Of course, you have to do some sort of exercise to build your muscles. So
I agree. Excellent. Here we go. Tiffany, I like this one. Taking anti-inflammatories before exercising will lessen the inflammation and pain. What's your take on that one? I have people tell me that all the time. Doc, I'm going to take this Advil before I go out and hit that golf ball around. It's a preemptive strike, so I don't get no pain.
You're setting yourself up to injure yourself. So do not take anti-inflammatories, so you can just try to work through that whatever pain you're having. You need to find out if you're actually having that pain, or if it is an injury or things like that. I wouldn't take something just to try to push through it, because then you are going to hurt yourself.
I also say that sometimes inflammation's not necessarily a negative thing. Say you twist your ankle swells up. You're gonna have inflammation. That's actually a good thing, and the body's gonna respond. Sure. It's gonna start this cascade of events that can help you overcome. And I don't know if I want to have maybe a response of a good inflammatory response be blunted by an anti-inflammatory on board. Right. Here we go. We'll do a couple more of these ones. I like this. All right, Dr. Legaspi, the vegan diet fails to support optimal performance in athletes.
I talked about this a little bit earlier.
Yeah, I was on my crusade a second ago.
Yeah, that would be a myth. You do need to be careful to supplement certain amino acids, because there are some amino acids that are far more prevalent in, let's say, animal meats than they are on a plant-based diet. But it can be done. Excellent. Again, The Game Changers, a great movie, by the way, talking about athletes and what they do on a plant-based approach. Here we go. A couple more of these and then we'll be done. I like this one. Tiffany, here we go. Glucosamine rebuilds damaged knee cartilage. Do we know the evidence on that one?
I can't say that there's enough research out there that show that actually rebuilds it. from experience, patients seem to love it, so it makes them feel better. And whatever makes you feel better, I'm all for. But I don't know if there's enough out there to say that it actually rebuilds the knee cartilage.
What's your take on that one, Dr. Legaspi? Have you seen any data out there?
No, there's
I haven't seen any.
there's no evidence to support that it rebuilds cartilage. If anything, it's financial harm.
Okay.
It's not going to hurt you, but you're paying to take a supplement that doesn't really show any benefit.
All right, I got you on that one. I'm going to do the last myth versus facts myself, because why not participate? I give myself, this is a lob ball for me. This is the easy one, home run. Here we go. Eat healthy, stay active, be smoke-free, limit alcohol, and get adequate sleep to help sustain your physical performance during exercise or sports. That is a fact. Love it. So there you go, myth versus facts, guys. So we got about 5 minutes left, and so really I want to bring it on home. We've had this great discussion about sports medicine, but just the underlying theme of, well, we want people to be active, however they want to be active, and to the best of their ability. Because again, as we do well with just physical activity, it's just part of the broader lifestyle approaches. So let's take it on home. Tiffany, give us a couple words of wisdom or a few take-home points for people out there that are listening to us to encourage physical activity and things like that.
Okay. I know one of the big points we talked about is making sure you're getting enough sleep, enough hydration. Also, if you have any sort of injury, pain, ache, things like that, we're not supposed to live in pain. So I would visit a physical therapist to do an injury screen on you before you start any sort of exercise program. And then also very important as far as recovery, whether you are, again, getting enough sleep, roll yourself out, stretch, things like that, so you can prepare for the next day.
Excellent. Well, thank you, Tiffany. It's been great having you on the show again. I cannot wait to collaborate again in the future. Dr. Legaspi, give us a couple take-home points out there for people to be successful with today's theme of sports medicine and increased physical activity to their discretion.
Sure. So, if you've got a goal, usually it's a long-term goal. So you want to focus on incremental improvements to eventually hit your goal and to keep yourself motivated. Remember, no shame, no blame. Wherever you were before, any sort of forward progress is forward progress. So, think about it that way instead of what you may not have gone as far as you expected, but any forward progress is better than nothing. Don't overlook diet and nutrition, and remember to be, for the kids, remember to be an athlete first, and then the specialist second.
Excellent. Well, thank you, Dr. Legaspi. It's been great having you on my show today. I can't wait to collaborate with you again on future topics. So my final points are this. We talked a little bit about really it's a mindset. I mentioned earlier, you got to ask yourself what are you trying to do, why you're trying to do it, and how you're going to get there. It's part of the broader journey, and we don't want to lose perspective on that one. Remember, you have things that you want to do, things that you've chosen that you want to focus on. You have your obligations in life, and you also have things that you want to do for yourself. Don't ever forget about it. As a former guest of mine said, self-care is not necessarily selfish. We want you to get to your health goals, but in order to get to those health goals, you got to be willing to put in some effort. There's no doubt about that. But if you stick with it and you stay consistent, I promise that you'll reach your health goals and your life goals too. So I want to thank my guest today, Dr. Tiffany Crutcher. Check her out, Clinic Director, ATI Physical Therapy. Check her out at www.atipt.com. My good friend, Dr. Henry Legaspi, Board Certified Physical Medicine and Rehabilitation Physician, Elmhurst Neurosciences Institute. Check him out, www.eehealth.org. You've been listening and watching live on Facebook and intellectualradio.com. This episode is written by Mark D. Gomez, MD, and Tiffany E.R. Gomez. Producer is Tiffany E.R. Gomez. Music is by the wonderful Mr. Havis. Copyright 2019 by MDG Wellness LLC, all rights reserved. Stay tuned for my next episode next week. Rheumatologic conditions made ridiculously simple. Remember, share this show. Check me out on my website, www.drmarkgomez.com. Peace out.